Well, Dr. Carlson, let's talk about orthotics. There was many orthotics out there. You can pick them up for $2 at Walmart or wherever, and you can pay hundreds of dollars at a podiatrist, and there's things in between. Number one, tell us a little bit, is there some use for the cheap ones also? Is there no use for them? Are they maybe even hurting? And specifically tell us what an orthotic is supposed to help with and what long-term and short-term difficulties it helps out with.
All right, let me start with orthotics. There are several categories of orthotics. There are prefabricated, which are the ones that you would buy in the local drugstore or a Dr. Scholl product, and then there are custom-made orthotics. An orthotic, the purpose of an orthotic is to support your foot. So if you get an orthotic or something in the drugstore and you can bend it with your hand, that is not that is really not an orthotic. That is more of a cushion for your shoe. So a lot of the products that you see on the outside are really just cushions or inner soles to help cushion the foot and not really support and correct the way the foot walks. There are some prefabricated orthotics which are hardened, and they do have a general arch support in it, and they do support your foot. Those orthotics could be used for some simple problems such as generalized heel pain or arch pain. They do help with that. Then we come into a custom molded orthotic. What a custom molded orthotic does is that actually corrects the way you walk, balances out your foot, and corrects the problems. So to give you an example, some of the things that we correct with a custom orthotic would be first MPJ, range of motion, meaning the big toe, if it doesn't move up and down enough, it can inhibit the way you walk, and it's a problem with walking. So we make modifications in this device to help you with that. Some other things we do is actually make an arch in the device, which is made out of a hardened plastic to support your body. You have to remember that we support 3 times your body weight. So easy math when you walk is if you weigh 100 pounds, that device needs to support 300 pounds of pressure repetitively. So it needs to be made out of a hard plastic. So we would make an arch or a heel cup that would support the foot out of a material strong enough to provide that for you. Some of the problems that we correct with orthotics are neuromas. We stabilize bunions and hamatoes. We actually correct plantar fasciitis and heel pain with that, calcaneal spur. Some devices that we use for children, we actually help with their gait. Some children, when they first start to walk, you may notice they walk pigeon-toed. There are orthotics that actually can help correct a child walking pigeon-toed and make them walk straight. So that's another thing that we do with the orthotics.
Okay, there's a couple of words you used. One I already don't know how to repronounce. One I still do is the plantar fasciitis, but then after that you used another word which I have no clue what it is. I would appreciate if you kind of like let us know, yes, this is a clinical term and maybe some people know it, but many of us don't. Tell us what the illness, what the problem, what the symptom of it is in those couple of illnesses you mentioned, which where you used some medical term here.
Okay, so one of the first ones that I used was plantar fasciitis, and the common term for that is arch pain. All right, another thing we discuss is calcaneal spur or heel spur, and that would be heel pain. So heel and arch pain kind of go hand in hand. What happens is when a person walks and their arch or their foot flattens, the main band of tissue on the bottom of the foot pulls from the heel, and it gets strained and irritated. So orthotic will support the arch, and so that main band of tissue doesn't strain or pull. The other thing I spoke about was hallux limitus, which actually is a medical term, and that term is when the big toe does not bend. It gets very arthritic. And in order to walk, our big toe needs to bend, or our hallux, our great toe needs to bend in order to walk properly, to push our body weight forward. So it would just be a stiff big toe or an arthritic big toe. And sometimes that would happen with a bunion. And I'm pretty sure we all know what a bunion is when the big toe crosses over the second, or you have that large bump on the inside of the foot that gets reddened. A lot of times that's arthritis in there, and arthritis limits the ability for that toe to move in the joint because you get, arthritic spurs. So orthotic devices can help with that. We do certain modifications in that to help the toe bend and to comfort the person and help them walk a little bit better with that. Did that clarify for you?
Yes. Enough? Yes. Okay. So basically.
Oh, and the other thing I also mentioned was neuromas. That is when a person gets this shooting electrical pain into their toes when they walk. That's from a swelling of the nerve in the foot. So what we can do is make a modification in the device to help make a little more space so that nerve doesn't get compressed in the foot and alleviates that electric shock pain that patients, have once in a while.
Got it. Okay. So basically, orthotics can help out with many of those things. And so basically the cheap orthotics you buy for $2, $3, $5, they're mainly a cushion. And for being, I guess, cushioning sometimes isn't a bad thing, right?
Yes. It's not a bad thing, but it's not solving the problem why they're getting the pain and the symptoms. It will just, put a little extra padding in there for any kind of pressure, but it's not helping the symptoms or heel pain or arch pain
Right.
or bunion pain or the shooting electrical pains that a patient may have.
Right. Well, it was a really good thing, which I didn't know, and maybe many people didn't know, that like if you can bend it, then obviously it's too weak to support you.
Correct.
I mean, that makes common sense.
Yes.
And so if you have a flat foot or whatever it is and it needs to be pressured up, well, it will be flatten it. So you need, and also probably different people, by, structure of their feet and their body, and how much they're out whacked, or just like with a car, they need a particular adjustment. So again, the ones which are prefabricated, they may be good, but they may be adjusting him a little too much or a little bit too little, and either way, that might not always do a good job either. In fact, frankly, might sometimes hurt him, more, because if it's kind of too much. Anyway, it's not the right thing, and you wouldn't just align a car by eyeballing it. You get the specification of that car with that tire, with that type of things, and you do it, and that's basically what you're talking about, right?
Exactly correct.
Okay. Well, very informative, Dr. Carlson. I'm glad we covered that topic. Thanks a lot.
Oh, you're very welcome.